So, welcome and thank you for coming to our discussion. It's called Femininity Unlocked, where hormones, energy, and intimacy collide. I'd just like to quickly introduce myself. My name is Rosie Green. I'm a journalist and a beauty editor, and I have been for 3 decades, which is a very long time. I started off in glossy magazines. I've worked at Vogue and Elle and Red, and I'm now the beauty director at You magazine, which is the Mail on Sundays, Sunday's colour supplement. Now, as you might expect from the title of today's talk, we are going to focus on women and the challenges and the experiences we face. And I feel incredibly lucky to be joined by these 3 experts. So, there is Dr. Mayoni GOONERATNE. Here she is, amazing. Gerad KITE.
Hello.
Hello. And Dr. Aurora Almadori.
Hello.
Between them, they have helped hundreds of thousands of women navigate these challenges, and they've improved the health for lots of us. Now, some of the challenges that they've helped us with have previously been taboo, things like menopause, fertility problems, burnout, or issues with intimate health like pelvic floors or vaginal damage post-childbirth. But we are here to discuss them all. And just so you know, so I can squeeze as much wisdom out of them as I can manage, we're going to sort of do each expert in 10-minute sections. So, firstly, I'd like to say hello to Dr. Mayoni GOONERATNE.
Hi.
Hello. Would you mind introducing yourself and telling us all a bit about what you do?
Absolutely. So my name's Dr. Mayoni GOONERATNE, and I am a former surgeon. I operated on bowels and pelvic floors, and it inevitably ended up being in women in their 70s and 80s who'd suffered with life-crippling fecal incontinence. I then did a PhD looking at the control of continence, and again discovered more women who were suffering in a very undertreated and undiagnosed way. I then completed my surgical training. I left the NHS. I set up my own aesthetics practice, and very quickly realised that women were talking to me about everything else. And Skin Fit, Mind Fit and Body Fit was born. I went on to create Human Health, which is very much a space for women to understand their metabolic health and really to kind of revisit their hormones in a very different way. I'm a functional medicine doctor now and really bring all of my skills to the table to help women thrive, because I just see women surviving, and it's time for a very different story now. Yeah.
That sounds incredibly impressive, and I'm sure you've helped so many people. Can you just, for novices, tell us what functional medicine is?
Absolutely. So, to me, functional medicine is about really getting to the root cause of the problems that people present with. And it means that we go right back and we look at things like your childhood, look at your genetics, look at childhood traumas potentially, look at life events, because your health is not just something that happens in one instance. It is informed by all of your life experiences and your genetics. So to me, it's much like taking your car in because it's not working very well, and rather than just someone saying, oh, it's fine, or let's just change the tyres, we lift up the bonnet, have a really good look at your engine. We might change the oil. We might do something with the carburetors. I don't know much more about cars, so I'll stop the car analogy soon. But
I was like, where's she going with this? Yeah. It's good.
But really kind of get into grips with what's happening. And so therefore, it's not a one-hit wonder. It's not about just taking some supplements or lying under, an infrared light, although there's lots of benefits to that. It is this whole person approach, which I think is really needed, particularly in this space.
Yeah, absolutely. And I know that the NHS doesn't function like that, sadly, but hopefully they will start to take notice of people like you. You also mentioned mitochondrial health. Could you talk to me a bit about that?
Yeah, absolutely. So mitochondria are little structures that sit in every cell of our body, apart from your red blood cells, but we have somewhere between 100 to 1,000 per cell, and we have 30 trillion cells. So they're quite important. They fire up and power up our bodies. They make energy, ATP, which is the kind of currency of all of our cells, and it's really how our cells function. And so mitochondria are really important because they're actually under the influence of lots of things. including our hormones.
Okay.
So it's really about understanding that our hormones aren't just sex hormones, they're not just about your periods, they are actually deeply ingrained in lots of body systems. We've got receptors for estrogen, for example, on every single cell of our body. So they do more than just help us have periods and help us have babies.
And how do you know when they're out of balance? Because you start seeing symptoms, the hormones.
Yeah, absolutely. So what I would say is these really subtle symptoms. I'm hoping people know about things like hot flushes and joint pains, etc. But it's the more subtle things that we start to notice when our mitochondria aren't working, like brain fog, tiredness, that extreme fatigue at about 4 or 5 in the afternoon, where, you know, I've had women say to me they could, if they had a bed in their office, they'd crawl into bed. And then that feeling of being quite wired then suddenly at 10, 11 at night when you're lying there trying to go to sleep. It's this sort of converse activity of our mitochondria because they're just not flexible enough. It's about allowing our mitochondria to use energy to keep you going through the day rather than just sort of stopping at 1 p.m.
How do you help people?
How do I help people?
Yeah.
Well, it's by really understanding that whole story that I
Yeah.
talked about. So, you know, our genetics are important, and we can look at something called nutrigenomics, which is understanding how our gene coding allows us to use and absorb things like B12, vitamin D, metabolize caffeine, for example, as well. So that's important. But also looking at our childhood events, which, you know, has to be done sensitively. But appreciating that there may be different levels of trauma that people have been through, and that may need releasing in some way. I'm not an expert in that, but I can certainly help direct people to that and help them recognise that there is an element of trauma.
Yeah.
And then understanding what current stresses are going on in their life. You know, and I think we need to be intentional about the stress that we take on. I'm not talking about, you know, being in bed all day and not interacting with the world, although sometimes that's quite nice.
Yes.
I think it is about understanding when our body is telling us to rest, when it is time to play, when it is time to kind of really up our game. So for me, for women to thrive, we have to be able to kind of keep smashing those glass ceilings.
Yeah.
But the only way we can do that is when our mitochondria are truly flexible. So it may be about optimizing our hormone health, certainly starting with our gut health, detoxifying, optimizing our metabolism, and the way we use and utilize food is really important. And really setting in place some form of nervous system reset. And I find that women really do well with a morning routine, just having something to help us with our day. A little moment of internal reflection in the morning can really power up the way that the rest of our day goes. And just encouraging us to use our circadian rhythms, for example, and often just getting out the way of our bodies. Our bodies are incredible, you know, much smarter than any AI. We don't really need that to help us. We just need to get out of our own way a lot of the time.
How interesting. And I think, you know, in terms of, I know that you work a lot with burnout. You're just talking about women, you know, taking to, I mean, are there kind of things that you recommend to quite a lot of women? I mean, boundary setting, presumably, but are there sort of, you know, do you believe in supplements? Do you believe in, what are the things you recommend quite often?
Absolutely. I think supplements on the back of testing, so I'm very much of the test don't guess kind of mindset. Unfortunately, the way that we currently rear cattle and grow crops and farm means that most of the time our food is not sourced in a way that's actually going to deliver the nutrients it's meant to. So sometimes we do need to supplement, but I think it needs to be intentional. And with testing really after about 3 months or so we know that we're kind of fulfilling that need. And certainly I think with burnout, it's about listening. It's about encouraging women to tune back in, because a lot of the time we've been kind of raised to do and to be very masculine in our energy, whereas actually women, you know, well, feminine energy is very, you know, creative and connected. So it's about reconnecting and remembering what we're actually designed to do, which can take a lot of time, particularly if we've been kind of taught to disconnect and not allow that kind of crosstalk to happen. So allowing women to to discover that, I think is really powerful. And giving permission to have those symptoms. A lot of the time, women I speak to have been dismissed or gaslit with their symptoms, and I'm often the first person that believes them. And I'm sometimes the first person they've talked about their trauma, which also makes me very sad, but helping them to realise how all of that connects and interacts with their immune system and their thinking is really important.
Thank you so much. And lastly, I just would love to talk to you about your work with the perimenopause and menopause, which is obviously seeing this incredible explosion of people talking about it. How do you feel that, the landscape is at the moment? Do you feel people can talk about it much more, or do you think there's still a sort of...
I think we're in a bubble,
Yeah.
particularly here and in other environments, and certainly when I talk to colleagues. But I'm always still absolutely gobsmacked by the kind of questions, and that's not to undermine the questions women ask me. I want you to ask questions. But the things that we don't know still upset me. And I think there's still a lot of work to do. I think my patient base is becoming younger.
Yes.
And I'm having younger women approach me about PCOS and endometriosis and inflammatory conditions. There's, a lot of use of things like the oral contraceptive pill, which has got a knock-on effect. There is a downstream action of using endocrine disruptors. The oral contraceptive is important. Please don't stop your pill. But there is an important point to note that it is not the same as our natural hormones. So there is an impact of using that synthetic hormone on our natural hypothalamic gonadal axis. It's going to have an impact.
It's going to have an impact. That's so interesting. Well, thank you so much. I could talk to you for hours and hours, but I think I need to move on to Gerad.
Thanks.
So this is the incredible Gerad KITE. Would you mind telling the audience a bit about what you do?
So my name is Gerad KITE. I'm a five-element acupuncturist, previously a psychotherapist. I got into acupuncture mainly because of the personal experience that I had with it, in how it literally transformed how I felt in myself and my health, and realized that the psychotherapeutic route didn't really work for me in the way that I had hoped it would. I've worked primarily with women, mainly because back in the 80s when I first started, women were the only believers in acupuncture, and men just thought it was a load of rubbish. So that's really why I ended up working with women almost exclusively. And that then led into me becoming, I've been known as like a fertility expert. But again, that was a bit of an accident, because it just so happened that I was treating women who thought they couldn't conceive and then started conceiving. So that's followed me along the way. But one of the things that I've always emphasized is that with the style of acupuncture that I practice, which is five-element acupuncture, we never ever treat symptoms of any kind. Really, our main job, or our only thing that we can do, is restore balance and harmony. And the outcome of that is that what I would say is a miraculous self-healing opportunity emerges.
Wow. And could you explain to us the difference between five-element and TCM? Because I think that's the most... Is that the most common form of acupuncture? TCM?
Yes, so there is a pretty much a big divide between the two styles of acupuncture. Classical five-element acupuncture was the original style of acupuncture that was very much based on the idea that if the acupuncturist helps maintain the balance within the person, they not only stop becoming unwell, but they also thrive in their own lives. It gives them the opportunity to really be who they are. When the communists came in the late 40s, they wanted a system of medicine that addressed the issues of people, so more symptom-based. And so TCM was created in response to that. So that's the main difference, is five-element looks to find out who the person really is, to find out in what way they go out of balance, and to bring them back into balance, but not to chase symptoms. TCM does deal more so with syndromes, symptoms, and so on.
So interesting. And can you tell me, how does it sort of, if you want to bring about transformation or healing in somebody, how is that actually happening in the body when you're doing acupuncture?
So the big jump that most people have to make to accept acupuncture is to believe that there's such a thing as energy, or qi, as the Chinese call it. once you understand that everything in the universe is composed of this movement of energy, a bit like you were talking about the mitochondria, this is just another way of looking at how the life force of the universe individually manifests in each of us. So really it's an understanding of how nature works. So once you understand it, and in this system we understand it through this concept of the five elements, that the five elements simply are a way of looking at nature and breaking it down and saying, okay, so these are the natural movements of life. And what we see on the outside, which is a self-healing process, an evolutionary process, this also happens on the inside. So it's no different than science, really. I mean, science is a study of nature. So acupuncture is one way of looking at nature, Western medicine is another way. But really, they're doing the same thing, just very different approaches.
What are you, I mean, you've obviously been doing this for a while. What are women presenting to you with now? What are the challenges that you feel that they're coming to you with most?
Well, the big one for us has always been fertility.
Yeah.
Because I think around the time that I started, it suddenly became more of an issue in that women were having children later.
Yeah.
Women also recognized that there was something else going on other than a medically diagnosed problem. So this whole thing of unexplained infertility was a big thing. It was like kind of an epidemic of not knowing what's going on. And because Western medicine didn't have any answers for that, other than trying different medical procedures, people were looking for an answer. So that historically is why people are coming to us. Now I would say it's much more about people just wanting to feel well. I mean, it's interesting being here with, looking at how important it is for people to look good on the outside. But it's still, I think, largely ignored how we feel well on the inside. And I was just saying to someone, the worst thing that can happen is, you start to look great on the outside and it doesn't match how you feel inside.
Yes.
And I think that in itself become a widening problem.
And you've just, in September, written a book that's been launched. And so that's called The Untapped Self.
Thank you.
So that follows different people and their sort of challenges. Is that right, in the book?
Yeah, so it's based on my patients. So they're composite characters. So I've taken people with a different diagnosis from an acupuncture point of view and looked at the typical patterns and scenarios that you see, where how people come in at the beginning and they present in a certain way with certain symptoms, certain problems, and watching how they transform through that process, through acupuncture process. So they are short stories, really. They're case studies. But it's more about really understanding traits within ourselves and how we can relate that to how nature works and the elements, as opposed to personality traits.
And what are the sort of, I guess you can help everyone, but what are the main issues that people present you with that you see quite a dramatic change with?
Well, there's normally a physical symptom that gets people through the door.
Yeah.
But I think as soon as you start talking to them and asking the kind of questions that we ask, they reveal very quickly that there's a lot of other deeper stuff. I mean, going back to talking about childhood traumas, talking about current relationship issues, what they suddenly realize is that it is quite a lot that is impacting on their health in lots of different ways. So it could be anything, to be honest. I mean, people come in, but very quickly, people, I think, realize that they do know what's wrong with them.
Yes.
I always think the first thing someone says to me, when I say, if you could get anything from this treatment, what would it be? People typically say straight away what they know is the root problem. And it often surprises them as they say it. Because I think they recognize that there's a freedom to talk about the more abstract aspects of themselves rather than the tangible or logical.
That's so interesting. And just for people who might be new to it, what sort of, how much time would they need to dedicate? Do you sort of come for one session? Are you in it for life? Or is it just, again, that change?
Well, it was developed as preventative medicine. So the whole idea is that you would have treatment for your whole life, but not that often. The idea was that the practitioner's job was to keep you well, not to take you back from disease or depression, whatever it might be. So typically, if someone comes to us, we expect to see them once a week for about 4 weeks.
Yeah.
Then we start to wean off maybe 2 weeks, then a month, and then the goal is that maybe 3 or 4 times a year. But that really is to keep them well. The way the Chinese used to see it is you'd pay a retainer, to your practitioner to keep you well. And if you became unwell, you'd stop paying until you were well again. So it was a very, very different attitude to health and well-being and the role of the practitioner.
Gosh, how fascinating. Again, I could keep talking to you forever, but I think I probably need to move
Thank
on.
you.
So lastly, we've got the Miss Aurora Almadori, and she's a plastic surgeon. She specialises in intimate regenerative surgery. I don't know why I've done yours instead of asking you to do it. So could you talk a bit about what you do?
Absolutely. Yes, so I'm a plastic surgeon and I have a subspecialty in vulvar reconstruction. And I'm also very passionate about regenerative surgery. I've been doing a lot of research over the years with a PhD, focusing on adipose-derived stem cells, fat grafting, and the different application and different results that we can achieve with those procedures. And so when we talk about intimate surgery, there are so many different misconceptions and wrong messages that are often out there.
Absolutely. I think, people have the conception that it's for, just for aesthetics, or it's for people in the sex industry, or, it's such a wild area, isn't it, I think?
It is. It truly is. That's the main point. Majority of the women I see do not really come saying, I do not like the way I look, but anything just works fine, anything is brilliant. Majority have functional issues, or they are transitioning in a certain stage of their life, whether this is after childbirth, whether approaching menopause or during menopausal transition. It could be after a diagnosis of a chronic disease, like lichen sclerosis. Often women start having symptoms, but there's a lot of shame on one hand. Before really they approach physicians, the disease has been ongoing for years. Often it is misdiagnosed. Often they are dismissed with, it's just trash, it's nothing you should worry about, it's all in your head, you should just relax, calm down. Or whether this is after cancer treatment or traumatic experiences like FGM. So there's a number of situations where a woman can ask for some help.
Yeah.
In this specific area. And I think a very important, let's say, aspect is related to language. There is, of course, education, awareness, but language as well is very important. There's a lot of stigma. And women often feel uncomfortable about discussing symptoms, about the genitals, their intimate health. And I understand there are contexts where this can be done more freely and other contexts where it's not appropriate. But let's say in a medical environment, when you are with a professional, with a healthcare provider, I often have, I tend to have very long consultation because I really like to have conversation, understand the motivations behind it, the real issue that I have. But often it starts with, well, I have a problem down below.
Yes.
So I always say, now you repeat after me. It is vulva, it is vagina. It is important just to use the appropriate language, anatomical language, to reduce the shame that it comes with this. Because if you fall from the bicycle and you break your elbow, you go to the doctor and you say, I broke my elbow, can you help me? If you have a symptom in the genital area, often you tend to say, well, maybe let's wait a little bit longer, maybe this is normal, maybe this is what being a woman brings with, maybe I should wait, maybe it will get better, maybe any other woman is living with this without complaining. But often it doesn't have to be like that.
Yes, I can imagine it's a long time till some people present to you. Do you think that it's getting conversation, there's more conversation now? Do you think it's opening up, or do you think there's still very much sort of shame and stigma around it?
I see definitely progresses on this regard. I think still there's a lot that has to be done, educating women, younger generation, but men as well, because it is part of life. And it is not just about sex or intimacy, it is really about often everyday function and also about feeling whole, feeling complete, feeling at ease in your own body. Because some of those changes occur in life in a moment where you should be happy for other things going on. For example, after childbirth. It's one of probably most beautiful moments a woman can live and one of the most beautiful experiences for a woman. But I've seen young ladies with problems, traumatic childbirth, stitches that got infected. They had to be resutured, and they cannot sit for long hours. They struggle in breastfeeding the baby. Very simple things, and they feel they are failing the family, that they're not good enough mother, or struggling with the intimacy with the husband, and despite having plans of having many children, the anticipation of pain can be devastating, and it is really complex and multifactorial, and it affects the entire family. It's not just the person herself.
Yes, I mean, so it's incredible the work you do. Is there, what would you say would be your most effective surgery? Or, the sort of, the thing that you can do for a lot of women, they're sort of struggling with something, and you say, actually, I can really help with that. Would that be a pelvic floor situation or tears, or what would be your sort of...
That's a good question. I like to, this is why I like to speak with them a lot, listen a lot, but also understand the language they use and the meaning they associate with it, because sometimes, often, the same words might have slightly different nuances for me and for the person I have in front of me. So I really try to understand what's behind. So first is listening and understanding what they truly mean. And then develop a plan, which usually is personalized, and it is not necessarily surgical. For example, when there is pain, which is pain, discomfort, dryness, those are the main things I deal with. But with pain, there is an external component that is related to the skin. On the outside, it can be scarring, it can be a condition, it can be many reasons. But there's also an internal component. So I'm a big supporter of pelvic floor physiotherapy. So the solution is not necessarily surgical. Surgery is kind of the last resort. And even when we reach the stage of surgery, plastic surgery training is entirely surgical, of course. And one of the first principles that they teach you is the concept of the reconstructive ladder. So you should always start from the less invasive procedure, and then you build up, going to the, let's say, to the more invasive surgery. I think regenerative surgery has huge potentials for a number of situations, a number of symptoms, a number of issues, but also because we can really personalize the treatment. For example, fat grafting is brilliant. I use fat grafting in nearly any procedure I do, whether this is in the face, breast, body, or in the intimate area, as a standalone procedure or as a combination with more traditional surgeries.
Because can I ask what that does? What does the fat grafting do?
So, well, basically we have, of course, we have fat cells that can increase volumes. So we can, let's say, increase the subcutaneous tissues, like a padding effect, but there is also a big source of stem cells. So the so-called adipose-derived stem cells, which, by the way, are all affected by a number of factors that has been discussed before, because stem cells are alive. So they are, let's say, they respond to healthy lifestyles, good nutrition, and an inflammation level, because a lot of the stress that we have in everyday life, many conditions are linked to the low-level chronic inflammation, which is really the real killer, and stem cells as well are part of it. So we need to work holistically to improve also the functionality of those cells. And once they are injected in the tissue, basically, they release biochemical factors. I won't go too technical, like cytokines, growth factors. But all those things are helping, let's say, the surrounding tissue to kind of behave in a healthier way. So they stimulate the right collagen production, so reducing scarring or increasing tissue vascularization by the formations of new vessels. And we can really tailor the treatment. In the same area, we can use larger lobules to increase volumes, smaller lobules with more, let's say, enhanced concentration of stem cells to regenerate, a combination of these. So it's really, I find it very useful to really provide a personalized treatment. There's no one size fits all doesn't work anymore in surgery. We know that.
Yeah, sounds very interesting. Could I just ask, I know we had a talk and we were saying that the idea of trends in this kind of surgery is, an anathema to you. Could you talk a bit about that, about, trends that you think are a bad thing, and then also maybe what you're excited about in the future that you think could really help in this space?
Yes, there is always trend. There is trends in what, let's say, was the big topic in the conversation in the arena of cosmetic surgery, whether this is purely cosmetic or whether this is overlapping with reconstruction. I am not a big supporter of trends, especially in when it is surgery. Surgery is a serious thing, even minimally invasive procedure, but still it is surgical, and people should understand that this should not be taken lightly. So if the trend is about a specific feature, let's say the foxy eye or whatever, I'm very cautious when somebody tells me, well, I know there is this thing that is happening, I saw this on the Instagram. I always try to educate first. For example, when I do consultation for intimate issues, I always use diagrams explaining anatomy, the huge variation among different women, and that everything is fine. There are a lot of different features that a woman can have, and there is no one that is right, no one that is wrong, unless there is a condition. So I think this type of conversation and education is important, but also how the anatomy evolves over time. For example, a young woman asking for, let's say, very radical labiaplasty.
Yeah.
I always try to explain the function of the inner labia, the modification that her body will go through later in her life, and the function of the inner labia when she will go through menopause, the importance of protection and prevention of dryness and additional symptoms. So I always try to have not only an holistic approach in the moment, but also try to kind of invite them into a reflection, which is that the body is a container, is a vessel that contains her soul, and it will be with her for the rest of her life. So she should kind of more focus on the well-being for the rest of for the entire lifespan, rather than just following the trend of the moment, which is my regret.
Amazing, thank you. Well, I can't believe it, but I think we're at 5 o'clock already. So I just want to say thank you so much to each of you. I really appreciate it. It's so nice to meet you. And thank you to everyone that has listened. I think we can all agree that was fascinating. So thank you very much. I think we need another session in 2 weeks' time. Thank you very much.
Thank you.